Hi everyone, I am Stephanie Manassi and I am a clinical psychologist and assistant research professor at Drexel University. And today I'll be talking about how to recognize and get treatment for eating and weight concerns. So I'll be talking about a spectrum of different concerns people might have, from being overweight and wanting to lose weight to suspecting an eating disorder in a child. And so I'll try and cover a lot of ground today, but what I'm hoping is, I know that there are a lot of people online. Please feel free to shoot over your questions as you have them, because I would like to answer them as I go along if you have questions that are relevant. So please feel free to shoot over your questions if you're online, or if you're here in person, just raise your hand and I'll be happy to elaborate on anything that I kind of skim over, since I'm talking about a lot of different things and a broad range of issues that people might be interested in or have concerns about. So just as sort of an outline of what I'll be talking about today. So I'll be talking about overweight and obesity, what it is, and what kind of treatment is available for that. If you're somebody who is looking to lose weight or get help changing your lifestyle or your physical activity, or change your diet, what kinds of treatments are available, what the best approaches might be, and what some not good approaches might be as well. And I'll also touch on what to do if you're worried about your child's weight or diet, because that is a common concern for people. So I'll talk a little bit about that, and of course I'm happy to answer questions about that as well. I'll also talk about eating disorders and what eating disorders are, how to recognize an eating disorder in yourself or someone else, and then talk about available treatments for eating disorders and what those look like. And then I'll also want to spend some time talking about some programs at the Well Center and Well Clinic that you might be a good fit for or eligible for, because we have a lot of things going on where you can actually receive free treatment or free intervention, and we want to make sure that Drexel employees and people really know about this stuff that's available to them here at the Well Center. So what is overweight and obesity? It's an extremely common issue in the United States. Over 2/3 of Americans fall into the overweight or obese category. And when I say that, I mean in terms of body mass index, which is essentially a calculation of your current weight status based on your height, weight, and gender. And a body mass index above 25 is considered in the overweight range, and a body mass index above 30 is considered in the obese range. So you can literally Google BMI calculator and put in your height and weight, and that'll tell you what your BMI is. One thing I want to emphasize is, just because you have an overweight or obese BMI does not necessarily mean you need to lose weight. So many people are healthy at an overweight or obese BMI. However, what the research shows is that on average, being overweight is associated with some medical complications, such as cardiovascular disease, hypertension, cancer, puts you at risk for a lot of different health problems, including joint pain, back pain, things like that. But that's not necessarily true for every person who might fall into the overweight or obese range. So I would encourage you to talk to your doctor about whether weight loss would improve your health. Because for some people, having a BMI of 27 is perfectly healthy, and for other people, having a BMI of 27 might mean that they could benefit from losing some weight. So it really is an individual case-by-case basis, and I don't want anyone to think that just because you fall into a certain BMI category definitely means you need to lose weight. But many people who do fall into those categories do want to lose weight and want to seek out ways to do so in a healthy way and in a way that leads to sustainable changes in the long term, which makes sense. So just as an overview of the types of treatments or interventions you can pursue if you want to lose weight, there's certain programs you can pay for. So things like Weight Watchers has pay grades for different levels of programming you can get. There's a free app you can, or there's an app you can get, but you often have to pay for extra features or pay for groups or for coaching, things like that. There's programs like Jenny Craig where they can send you meals and things like that. There's a ton of weight loss apps out there, so things like MyFitnessPal that can be used to track your calories and see where you're at and set a calorie goal and see how many calories you're burning and try to eat fewer calories in order to lose weight. There's all sorts of structured diets that you can follow, things like Atkins, low carb, keto, Whole30. Every few years you hear about new types of diets that come out there, and certainly those are things that you can follow. There's also behavioral and lifestyle modification, which I will talk about the most because what the research shows that is the most effective method for managing your weight. There are also a number of medications and weight loss drugs that you can take. I would say that they're of mediocre efficacy. Most of them are not super effective. And then there's the most extreme version of a weight loss treatment you can get, which is bariatric surgery, which essentially consists, depending on the type of surgery you can get, consists of actually getting surgery to reduce the size of your stomach so that it makes it impossible, basically, for you to eat calories, and people lose a lot of weight with that surgery. What I'll say about these programs is that unfortunately most of them are not effective, are very minimally effective, and if they are minimally effective, it's mostly in the short term. There is not one diet that works better than other diets in terms of low carb, Atkins, Whole30, keto. Mediterranean diet, what the research shows is that they're all pretty much exactly the same in terms of how well they work. And I think what the science increasingly points to is the diet that works best is the one that you can stick to. Because that's really all that matters, is that you can stick to that diet. Because for some people, something like a low carb diet might be way too restrictive and not something they can keep up in the long term. Whereas for other people, maybe that's actually the best possible diet for them. So really the best diet is the one that you can stick to in the long term and feel sustainable. Because I think one thing that happens is that people kind of have this preconceived notion that if I just lose the weight, then that's all that matters, and then I can go back to normal and I can keep it off that way. When unfortunately what the research shows is that whatever changes you make to lose weight, you have to keep those going in order for the weight to stay off long term. So whatever you're doing to lose weight, you have to feel like, in order for it to be sustainable, you have to feel like you can do that for the rest of your life. So if you're choosing a specific diet to follow, that's what I would lean towards. However, what we know for sure are the most effective interventions for managing weight are behavioral treatment or lifestyle modification and bariatric surgery. So I'll talk a little bit about each of these options a little bit. I'm not going to talk too much about bariatric surgery since that's outside of my wheelhouse. We don't do that here at the Well, or we don't do that at the Well Center. But bariatric surgery, there's lots of different options you can go for there, and they are, more effective than behavioral treatment. But many people shy away from those because it feels like an extreme option. But if people have questions about that, I'm happy to answer. Okay, so when I talk about behavioral treatment or lifestyle modification, there's a very specific way that this looks. And this is, again, I would say the gold standard, best possible way to manage your eating and weight. Almost always the best behavioral treatment includes weekly or so sessions with some sort of coach, a psychologist, a dietitian, or other professional who's trained in behavioral modification. Because that's what this is changing your lifestyle, changing your behavior. And the focus of behavioral treatments are to alter the calorie balance. So you can see here in this figure on the right, your weight stays the same when the calories you eat and the calories you burn are about the same, right? So sort of that pendulum is equal, and that leads to your weight staying the same roughly. Weight gain happens when the calories you eat exceed the calories that you burn. And likewise, the calories you burn, if you burn more calories than the calories you eat, that's what leads to weight loss. And so that's intuitive to most people. However, actually making those changes, especially over the long term, can be really, really challenging. And so that's where someone like a coach or a psychologist or a dietitian can help you come up with strategies that are effective for changing the calorie balance and keeping up that calorie balance in the long term. Any sort of good lifestyle modification includes food tracking as well. So how do we know what to change if we actually can't see what you're eating? And so apps like MyFitnessPal are really good for this, or some people just go with pen and paper. But food tracking really is one of the cornerstones of lifestyle modification. And many people who we've worked with who maintain their weight losses in the long term are tracking their eating for extended periods of time, sometimes for the rest of their lives. In general, we have people sort of pick their calorie goal and what works for them. But usually if you're under 250 pounds, that means between 12 and 1,500 calories a day. And if you're above 250 pounds, between 1,500 and 1,800 calories per day. Lifestyle modification also includes other strategies like learning how to plan, learning how to set up your environment for success, and also increasing physical activity. So I have an asterisk here by physical activity because I think one thing I want to highlight about physical activity is that it's a really important part of lifestyle modification, but for the most part, exercising more won't help you lose weight. And the reason for that is that we just burn so many fewer calories than we think through exercise. In order to lose a pound just through physical activity alone, or in order to lose a pound, you have to have a deficit of 3,500 calories. In order to burn 3,500 calories, most people would have to run 6 miles a day, 6 days a week. And so that is a lot of physical activity, and most people don't have time for that, don't do that. So physical activity on its own is really not an effective way to lose weight for most people. Now, some people that might be different, but on average, if you just increase physical activity and don't change anything about your eating, your weight is unlikely to change very much. However, one thing that physical activity is really good for is helping keep weight off in the long term. And this is something that science has yet to fully understand yet because we don't really understand why metabolically, psychologically this is the case. But when people are engaging in large amounts of physical activity, they are much more likely to be able to maintain their weight losses in the long term. So most people regain their weight that they lose, unfortunately, but people who are highly physically active have a much better chance of maintaining their weight losses in the long term. So we don't really understand a lot about why that is. But it is something that we know from the research. So if you're someone who's hoping to manage your weight, physical activity is a really important part of all of that, but on its own probably won't help you lose so much weight. And part of that might be is that people actually sometimes experience greater appetites when they exercise more, so they might be more likely to not stick to that calorie goal if they've exercised. So that's one possible reason that for weight loss, exercise is not necessarily the most effective strategy on its own. So I wanted to talk a little bit about if you're somebody who is worried about your child's weight, because this is a really sensitive topic, and I think more and more people are, very, very justifiably talking about, well, I don't want to, give my child a complex about their eating or their weight. I want them to have a healthy relationship with food. But at the same time, parents are also sometimes worried about their child's weight and whether their child is at a healthy weight, because makes sense. They don't want their child to have health problems in the long term. Child and teenage weight is much more complex than adult weight because you have to factor in growth. So just taking someone's, height and weight and gender isolated in time, who's only, 10 years old, is actually not that helpful. You have to take into account their growth over time and what their expected weight is for their gender, weight, height, and age over time. So often what that looks like is, getting a percentile for your child's weight. So if your child has been at the 40th percentile their whole life, but then recently has got up to the 60th percentile, that might tell you that that rate of weight gain is maybe higher than what would be expected for that child. Same thing if you're worried about your child's weight in the opposite direction. If your child's always been at the 40th percentile and then age 13, 14 come along and they're dropping to the 30th percentile or 25th percentile, that's another reason for concern. So if you're somebody who's worried about your child's weight in either direction, I would encourage you to work with your pediatrician to actually look at growth charts together to see whether your child has been sort of on the same growth trajectory in terms of height and weight over the course of many years, and whether they're coming off of that trajectory in either direction. So before, trying to have an intervention with your child and talk to them about their weight or their eating, I think consulting with your pediatrician about their growth trajectory and their weight trajectory is super important because we want to make sure that, if your child is someone who's always been at the 80th percentile, not that they shouldn't be worried about diet or eating, but weight loss might be kind of difficult for that child because that's just where their body is. So there's really a lot of variability there. So this has actually come up a lot recently. I don't know how many people have heard about the Kurbo Weight Watchers app for kids and teenagers that has come out recently. And so I know I've gotten a lot of questions about, is it safe to promote weight loss in my child? Is that a thing that's safe to do? Is it psychologically okay for them? Is this a really bad thing to be, talking about eating and weight in front of my kid? I think usually it's perfectly safe to talk about eating and weight in a specific way, which I'll talk about in a second. But if you're wanting to change your child's weight or change their eating, my view is that it's absolutely critical that you work with a professional to do this, a highly trained psychologist or dietitian who works with children and who works with weight management or eating disorders, because there are a lot of ways that parents can be inadvertently unhelpful in terms of promoting healthy body image and healthy eating habits in their child. And so this is a really sensitive topic. So if you're wanting to get more information about this, I would urge you to work with someone who's a highly trained professional, mostly because in order to promote your child's overall mental and physical health, it's important that we're focusing on talking to our children in the right way, which I'll talk about in a little bit. I'll give you some tips in a little bit. I think one thing that's important to note is that the research shows that, left to their own devices, children and especially teenagers will often resort to unhealthy methods of reducing intake. Certainly, especially teenagers are incredibly self-conscious about their bodies and their weight, and so many very large percentage of teenagers try to diet at some point. Unfortunately, teenagers are not necessarily the most well-informed about healthy ways to go about changing eating. So often they'll resort to unhealthy methods of changing their intake or their food. So things like skipping meals or cutting out entire categories of food or engaging in unhealthy exercise or even doing things like taking laxatives. There are lots of really unhealthy ways that teenagers resort to reducing intake. And so that's why, again, it's so important to work with a professional, because it can be damaging to say to a kid, all right, you need to lose weight, without ever talking about healthy weight strategies, because they might resort to unhealthy weight control attempts that will set them up to have poor body image, maybe higher disordered eating behaviors, things like that. So you want to be really careful about how you talk to your child about their weight and their eating. So I think I'm going to talk just for a couple minutes about tips for talking to your child about their weight and eating. I think this is such important information to disseminate to people. So one thing I really want to emphasize is that more than talking to your kid about eating or weight, modeling is the most important thing that you can do. So if you model eating a variety of foods, if you model eating fruits and vegetables, if you model engaging in physical activity, your child is going to be much more likely to have a healthy relationship with food and to like healthy food and healthy physical activity behaviors. So really, telling your child to eat their vegetables without eating vegetables yourself is going to be a hard sell for that kid, because they're learning from watching their parents or their mom or their siblings that they don't need to eat vegetables. They don't need to learn to like them. And so modeling is really one of the most important things that you can do. One point I really want to emphasize as well is that sometimes parents don't realize that this also goes for modeling healthy body image. One thing we know from research is that parents who make critical comments about their own bodies are more likely to have children who have poor body image, lower self-esteem, and develop disordered eating behaviors. So your kids are watching the way that you look at your body and the way that you talk about your body. So those offhanded comments about, I really need to lose weight, or I really hate the way that I look in this, your child is learning how to relate to their own body by watching you relate to your body. And so that is really one thing I want to emphasize is important to look out for, is that you really want to be modeling healthy body image for your child. And so that includes how you talk about yourself. Regardless of how you talk about their body, which I'll talk about in a second, they're looking at you for how you talk about your body. I think another helpful strategy for talking to your child about their weight and eating is actually not to focus on weight that much. Is to focus on healthy behaviors, eating fruits and vegetables, getting physical activity, and not that you should ignore weight, because certainly weight is just a thing that most people think about at some point or another, but the focus of really trying to, if you're worried about your child's diet, is to focus on behaviors. That is the most important thing, rather than weight as an outcome. So maybe this should go without saying, but any sort of criticism or negative comments about a child or teen's weight or body is incredibly harmful. We know from research that critical comments about a child's weight or body shape is much more likely to result in later disordered eating, poor self-esteem, depression, poor body image, you name it. Critical comments about weight and eating and body are harmful to children and teens. That includes making critical comments about other people's bodies as well, because your child is then learning from you that that is a very valuable thing, and that they should place a lot of emphasis on how they think about themselves, on what their body looks like and what their weight looks like. Even if you're not being critical of your own child or teen's weight, being critical of other people's body or weight, even just offhanded comments can be harmful. So this is a little bit counterintuitive too, but even positive comments about weight can be harmful to some degree. And the reason for that is that, again, it sort of models this idea that you should really care about your weight, and I value that. And so not that it's not inherently harmful to give a compliment, but at the same time, you don't want your children overemphasizing weight as a part of how they value themselves. So praising behaviors, praising the process, it's the same thing as all the research that shows that telling your kid they're smart is actually not nearly as helpful as complimenting your kid on working hard or the process that they engage in order to achieve something. Any questions about that? Okay. So now I'm going to talk for a few minutes about eating disorders. So one thing I want to emphasize here is that being at a higher body weight and having an eating disorder are not mutually exclusive. Okay, these are things that can happen at the same time. And so when I say I'm talking about overweight first and then eating disorder second, I'm not necessarily saying we're not talking about people who are overweight anymore, because eating disorders can happen in people of all body shapes and sizes. And that's something I really want to hit home hard today. So eating disorders in general tend to be pretty misunderstood by the public and media. People who have eating disorders are sort of often blamed for, purposely doing something that's harmful to them, and they feel like it should be controllable to not engage in disordered eating behaviors. But I want to emphasize that eating disorders are a really pervasive psychological disorder that you can't just snap out of it. It's not something that you can say, all right, stop binge eating, you should stop that. Or you should just eat more, just do it, just eat more. That's not how eating disorders work at all. It's like telling someone who has anxiety to just stop being anxious, right? How helpful is that? It's not something that someone can just turn on or off. So I think that's something to keep in mind if you are thinking about approaching a loved one or a friend about their eating disorder, that coming from a place of you just need to stop this is not going to be a helpful approach. Like I mentioned, most people with eating disorders are not thin. In fact, many are overweight. And I think even the majority of those with eating disorders are overweight. So that's something I really want to, emphasize here, is that eating disorders can happen in people of all shapes and sizes. So up here on the slide, I have a list of some eating disorders. We have Anorexia Nervosa, which is probably the most, sort of well-known eating disorder, Bulimia Nervosa, and Binge eating disorder. There's also other specified feeding and eating intake disorder, which I'm not really going to talk about today, and same with avoidant restrictive food intake disorder, which I'll talk a little bit about, but I won't focus as much on. ARFID, the bottom one, avoidant restrictive food intake disorder, can happen in adults, but is a disorder that usually starts during childhood. So just to talk a little bit about anorexia. So anorexia refers to restriction of energy intake leading to a significantly low body weight. And so people always have sort of like this image of what someone with anorexia looks like. And there are plenty of people who have anorexia who sort of fit that prototype of being very, very, very thin, so that sort of skin and bones type of look. But there are a lot of people who don't fit that mold as well. It's also characterized by an intense fear of gaining weight and becoming fat. And again, I want to emphasize this is like, if you're thinking about somebody with anxiety, it's that same sort of fear. It's a really pervasive fear. It's not just, most people are, somewhat concerned about gaining weight or concerned about their bodies. This is an intense fear of gaining weight, like someone would be afraid of a spider if they had a spider phobia. So this is really an intense fear. And then also body image disturbance, so feeling like they are overweight or fat even if they are at a very low weight. So just to talk a little bit about anorexia, anorexia starts in early to late adolescence. When I saw that the mean age was 15, I was surprised by that because most of the people that I've worked with anorexia, it started as early as 11 or 12, and sometimes 13 or 14. But it starts really early on, usually when kids are about in middle school. One thing that surprises people is that many individuals with anorexia have a history of being overweight. So they're before they had an eating disorder, they might actually fall into the overweight category, but then start dieting and actually are successful with losing weight. And then that is reinforced by their family or their peers. So if you remember back to when I said that even praising your child's weight could be harmful, this is an instance in which it definitely would be harmful to congratulate your child for losing weight, but they're just on this path to an eating disorder. So it's a fine balance here because there are plenty of kids who are losing weight in a healthy way, and it does feel like a great accomplishment to them, and you want to reinforce that. But on the other hand, there's a small number of people who are doing the same thing but are on their way to an eating disorder. And unfortunately, we don't have a lot of ways of knowing who's headed in which path. But this is something to look out for during adolescence in most kids. Okay, to talk about bulimia for a second. So bulimia, the first sort of characteristic of bulimia is recurrent episodes of binge eating. And we talk about binge eating for a second because this is something that is also misunderstood because people think about binge eating as like, oh, I ate a lot of pizza and that was a lot of pizza and I didn't really need to eat all of that. I regret that. And that might be someone's sort of definition of binge eating. But there's two criteria here, and the second one is especially important. So the first criteria for binge eating is eating in a discrete amount of time, an amount of food that is definitely larger than most people would eat. This is pretty subjective, but it should be an amount that is significantly larger than what someone might normally eat given that setting. The second piece is the most important, which is feeling a sense of loss of control over eating. So feeling that you can't stop once you start or that you can't prevent the episode from happening. So this is, I think, the thing that really distinguishes between overeating and binge eating, because we all overeat at times, and that's normal. But a sense of loss of control is the thing that sort of sets people apart and falls into the disordered eating category. When someone really, truly feels like they can't stop eating and feel totally out of control, the metaphor that I sort of use is like, it's like a train going off the tracks. Even though it's going off the tracks, it feels like you can't stop it. Or a ball rolling down a hill. It just like starts and keeps going and going and going and going until it reaches the bottom. And so it's this really compulsive drive or need to keep eating. So very, very different from enjoying an extra helping of dessert at Thanksgiving just because you enjoy it. So I really want to clarify that. However, it's not like you can actually tell if someone is losing control over their eating. Yes, sometimes they may be eating more rapidly than normal or seem more compelled than normal, but oftentimes these binge eating episodes happen in secret. They're not something that you necessarily see a lot happening. The other important criteria for bulimia is engagement in inappropriate compensatory behavior in response to the binge eating episode in order to prevent weight gain from happening. There are a lot of methods that people use for this. So things like self-induced vomiting, taking laxatives, diuretics, enemas, medications, compulsive exercise, fasting. So basically any sort of behavior that's sort of extreme that aims to compensate for the amount eaten during a binge episode. And I know that the families that I've worked with, they often notice the compensatory behavior before they notice the binge eating or know about the binge eating, because these are sometimes a little bit more obvious than others. They might notice something like their child always goes to the bathroom right after they eat, or there's frequent trips to the bathroom, or there's residue in the bathroom. So that's often what parents will come to me with noticing if their child has bulimia. So bulimia starts a little bit later than anorexia, so college is a really common time for bulimia to start. However, it can definitely be earlier than that. So I've definitely worked with kids who develop bulimia at age 11 or 12, but some people will develop eating disorders later in life as well. That's also not uncommon. In fact, many individuals with bulimia have a history of anorexia, so that's a really common trajectory where we have somebody who has anorexia throughout high school and then in college ends up developing binge eating and purging behaviors. So there's often some crossover between these disorders. Individuals with bulimia are often of a normal weight, but they often fall into the overweight or obese range. And one of the reasons for that is that binging and purging is not an effective weight loss method. It might be helpful for a little while, but typically people who are binging and purging actually gain weight over time. So it's not an effective weight loss method. So over time, people who continue to engage in these behaviors tend to actually gain weight over time. So again, you can't just tell by looking at someone whether they have an eating disorder or not most of the time. So similar to bulimia is binge eating disorder. So this is actually the most common eating disorder. This is the one that is most prevalent. It's much more common than anorexia or bulimia. And in fact, a large number of people experience binge eating, even if they don't meet criteria for binge eating disorder. So binge eating is actually, unfortunately, somewhat common. And so many people do develop episodes where they feel out of control of their eating. And this is something that can be treated, which I'll talk about in a second. But essentially, the criteria for binge eating disorder is the same for bulimia, but just minus the compensatory behavior. So minus the things like self-induced vomiting, fasting, compulsive exercise, etc. And to meet criteria for binge eating disorder, the binge eating has to happen at least one day a week on average for the past 3 months. So it has to be sort of like a once weekly occurrence. However, many people experience binge eating less than that, and there's still a lot of good reason to seek treatment if you're somebody who experiences binge eating or if you suspect that someone you know has binge eating. Okay, so let's talk about this for a second. How do you know if someone has an eating disorder? This is hard. There's a lot of different ways that you can tell or you might suspect that someone has an eating disorder. So with weight, like I've mentioned, weight is often not a helpful indicator of whether someone has an eating disorder or not. But if you notice a dramatic weight loss in someone, that can often be a sign, but it's not necessarily a sign. But again, weight is not necessarily a helpful indicator except for people who are extremely underweight. Other signs of someone having an eating disorder is very pervasive preoccupation with weight, food, eating, and calories. And when I say preoccupation, someone who's just constantly thinking about or obsessing over their weight, over their food, over eating, over calories. So someone who's constantly thinking about this, always on their mind, it's distracting, they talk about it a lot, that can often be a sign of an eating disorder. Refusing certain categories of foods. So one thing I've definitely noticed in teenagers that I've worked with is that suddenly they'll become vegetarian. And so that's a hard one, right? Because some teenagers want to become vegetarian because they love animals. But sometimes there's a second reason, and what often is the more primary reason of trying to cut out certain food groups in order to lose weight. But that's not the only thing that people will cut out. Sometimes people will say, I'm not eating carbs, or whole categories of food. Frequent comments about feeling or looking fat. That's unfortunately a common thing in many people who don't have an eating disorder, but in conjunction with some of the other behaviors can be a sign. Food rituals or rules. If you notice someone has sort of like a routine that they're kind of rigid about with their eating, that can be a sign. Body checking or pinching, so someone who's always kind of touching their body and feeling it and things like that. That's really common in teenagers. Secretive eating. So I think especially with binge eating, this is something that comes up a lot, whether it's a teenager or not. You might find wrappers in places, or food might disappear, or you notice that someone doesn't want to eat in front of other people. The sort of secretive nature of eating is common in people with binge eating. And then frequent trips to the bathroom immediately after eating might be a sign of different compensatory behaviors that someone might be engaging in. So there are a lot more of these, but these are just some of the ones I picked out that sort of span the range of all the different eating disorder types. Certainly, my view is that something like binge eating is a lot harder to know if someone is experiencing it or not. But I think what is a common thread throughout all eating disorders is rigid dieting. So if you notice someone who is dieting and is very rigid about what they're eating or how they're eating, that is often can be problematic. But again, it's a hard balance because there are certainly people who are trying to lose weight who are sticking to their plan. So again, it's tricky to figure out whether someone has an eating disorder or not. But these are some of the signs that have been published, but also that I've noticed in some of the people that I've worked with, or family members say they've noticed in people that they've worked with. So just a couple points on how to talk to someone if you suspect an eating disorder. This is really hard. And I think that if you really do suspect someone has an eating disorder, trying to get them into care, into treatment is, your best possible way of helping them. Please don't try to treat someone yourself unless you are a licensed provider, because eating disorders are really complicated, and talking to a professional is absolutely necessary. So I think one tip that I have is, I think one common theme in people, caregivers or loved ones of people with an eating disorder, is they understandably are frustrated with it. It feels like something that should be changeable, and you want someone to just stop vomiting, or to stop restricting their eating, or to stop binging. And so often what happens is that, a parent or a friend will sort of suddenly burst out and say, you need to stop this. This is, too much. You have an eating disorder, and come from a place of being accusatory. And it comes from a good place because it's often just wanting to help the person. But that sort of accusatory or sort of emotional outburst of coming to someone who you think might have an eating disorder is often unhelpful, because what I've found is that when people do that, that person with the eating disorder sort of disappears and doesn't want to talk to that person anymore. So you really want to come from a place of understanding and wondering and worry rather than being accusatory. So some phrasing might be something like, I've been worried lately about your eating. I've been noticing that you've been eating so little for lunch, and I'm just wondering if you're doing okay and what's going on there. So really coming from a place of wondering and trying to understand and worry, rather than an outburst of feeling frustrated, because it's really easy to get frustrated if you think someone that you have frequent contact with has an eating disorder, but coming at it from that angle is usually not a helpful approach. Okay, any questions about that before I transition into talking about some of the programs that we have at the Well Center? Okay, so the Center for Weight, Eating, and Lifestyle Sciences, or the Well Center, is an interdisciplinary research and clinical center within the College of Arts and Sciences. And our mission is to develop, evaluate, and deliver cutting-edge evidence-based treatments for obesity and eating disorders. And a particular specialty of ours is a focus on novel ways to change behavior and also novel ways of using technology to help aid in the treatment process in a few different ways. So, one of my favorite things about working at the Well Center is that we have the ability to offer people free treatment through our research treatment programs. So this is, I think a really rare opportunity because specialty eating disorder and weight management treatment is actually pretty hard to find and often is incredibly expensive. So there's our research treatment programs in which people are eligible to receive free weight management or eating disorder treatment through our ongoing clinical trials funded by the NIH. And so Drexel employees are fully eligible to participate in these trials, and we've had plenty of Drexel employees that participate in these before. Of course, everything is confidential. No one will know that you're in the study, but it's also nice that it's right here on campus. So we have several weight loss programs, including group treatment and sometimes individual treatment through these clinical trials, as well as eating disorder treatment, which is usually individual treatment, but sometimes group treatment as well. We also have clinical services that are fee-for-service. So if you're someone who's not interested in participating in a research study, we have a clinic with highly trained professionals in delivering evidence-based treatments where you can pay to receive individualized treatment with usually a psychologist, but sometimes a master's level clinician. We also have a child and adolescent program of which I am the director. And in the child and adolescent program, we focus again on developing and testing treatments for children and teens who have eating and weight concerns. And we also offer coaching to parents who might want to help change their child's diet, or if they're worried about their child's diet, help them change that. So we actually have one program in particular that's pretty cool going on right now that I can tell you about. Just to say a little bit about what we have available now, one thing I'll say about these research treatment programs, we're constantly having new studies starting and stopping. And so if I talk about if you're interested in receiving treatment for eating and weight concerns at the Well Center, but there's nothing that seems quite right for you, it's still worth going to our website and filling out an interest survey, because if you agree, we can then let you know when we have something that you might be eligible for. So just because there's not something right now that fits your needs, that doesn't mean that something won't be happening soon that will fit your needs. But just to say what we have right now in terms of weight loss research programs at the Well Center right now, we are currently recruiting for a year-long group-based behavioral weight loss program for people who also experience binge eating. So this is kind of spanning both the weight and the eating disorder side, where this is a great, 1 year-long program to help people manage both their binge eating and their weight. I'm actually a group leader for this study, so I've led a bunch of these groups at this point, and we'll be recruiting for a while. But I think it's a great program. Everyone gets, there's no placebo condition or anything like that. Everyone gets like a really, really good treatment. Well, also coming soon in the next few months, we'll have a year-long behavioral weight loss program for anyone who wants to lose the weight, regardless if you have binge eating or not. So this won't start for a few months, but you can, like I said, sign up now and reserve a spot in the study if you want to. We also have a weight gain prevention treatment available for young adults. So this is about college age kids, I think 17 through 24. So if you know someone who is worried about their weight but isn't necessarily looking to lose weight and wants strategies for preventing weight gain in the future, we have another a study for that where someone can receive treatment for that as well. We also have several eating disorder treatment programs at the Well Center currently. So we have Project Acquire, which is a 16-week cognitive behavioral therapy for adults who have bulimia. And in this study, all participants will use an app that we developed in conjunction with weekly in-person therapy. So no matter what, everyone gets the same therapy, and in conjunction with that, you'll be using an app to help track, and that will also aid you in using treatment strategies in the program. We also have a study going on right now that is testing whether a daily training delivered over virtual reality can help people reduce their binge eating. So people will either get a virtual reality daily training program, or they'll complete a computerized training program to help them reduce their binge eating. This is to help people manage their impulses or urges to binge eat. We have another study coming soon in the next month or two, Project Reboot, in which all participants will get cognitive behavioral therapy for either bulimia or binge eating disorder, either one. You can have either one and be eligible for this study. And in conjunction with this 12-week therapy, you will also do a daily computer training at home for the first few weeks. So there's again, another sort of technology component to it, but everyone gets, a really good evidence-based therapy for bulimia or binge eating. And I'll mention that cognitive behavioral therapy is the best possible treatment we know of for eating disorders at this point. We also have a couple of programs for children and teens at the Well Center going on right now. So if you have any kids who fall into this age range, or know people with kids who fall into this age range, we have a few good programs. So first is Project Beat, which is an individual binge eating treatment for adolescents, ages 12 to 19. So as I mentioned, eating disorders often develop in adolescence. So if we can intervene early, that's when we have the best chance for success. So Project Beat is testing a cognitive behavioral treatment for adolescents. And then Project Picnic, which again is a really cool study where parents can receive video coaching for helping their kid increase fruit and vegetable intake. So if you're a parent who's worried about your kid's a little bit picky or fussy around eating fruits and vegetables, this study it can help provide coaching for how to help your kid eat a healthier diet. So that's a very cool opportunity that we have in the child and adolescent program at this point. And so as I mentioned, we also have a clinic where you can pay for treatment. So the studies are all free of cost, but the Well Clinic treatment programs, you do pay for treatment. So we have individualized eating disorder treatment, so we'll treat any eating disorder. And there's also individual treatment with a weight loss coach. So those are kind of flexible, individualized plans if you're someone who wants to work with someone to help you manage your weight. And then we often offer groups of many kinds. So eating disorder support groups we have at times. We've been talking about starting a parent support group for eating disorders. So if that's something you're interested in, you can get in touch with us. But again, these ones are programs that you would pay for rather than the research programs that are free of cost. So no matter what you're interested in, if you go to our website, there's an interest survey that you can fill out, and you can choose whether you're interested in a research program or the clinical services, or both, and you'll answer some questions, and then you'll be sort of funneled to the right person to talk to about what kind of opportunities you might be a good fit for. And as I mentioned, if I didn't say anything that fits your needs right now, you can still fill out a survey, and we'll keep your information on file if you agree to it, and then we can get in touch with you when we have something that fits your needs, or you can just fill it out later too. But that would be the easiest way to get involved at sort of in the programs at the Well Center. So actually that's everything I have to present. My contact information is here if you have any direct questions for me, but we have a couple minutes if anyone has any questions. Otherwise, we can wrap up there. No? Okay.